Recently, a new guideline for asthma therapy brought this little inhaler into the spotlight. What's inside the special sauce from this combo from 2006? And do you really have to wash your mouth after using it every time? All that and more right after the title card. Hello folks, and welcome to this informational video on Symbicort. My name is Patrick, and I'll be your presenter for this video. This is split into mainly two parts. The first one will be going over things that are relevant if you are taking Symbicort, such as how should you take it, or what should you expect while on this medication. The second part will be a brief overview of some finer details of Symbicort, such as contraindications, place in therapy, mechanism of action, and other things that are more relevant towards healthcare professionals. If you are taking Symbicort or are considering taking Symbicort and are maybe considering changes to your therapy, always consult with your healthcare professional first. They will always know a little bit more about your situation than, say, myself or some random person in the comments. So, to start, Symbicort is actually a brand name. This drug is actually a combination of two drugs. The generic names for the combination drugs are Budesonide and Formoterol, and they come typically combined in these inhalers. So, as you can see, I've got one on me right now. This has 160 micrograms of budesonide and 4.5 micrograms of formoterol in each pump. And so, if you actually open this up and pump it down, it actually sprays. Now don't worry, I'm not wasting any drugs here. This is expired medicine from the pharmacy that they graciously let me have for the purposes of this video. So later I'll be going over some demonstrations and tips on how to use it. So Symbicort is typically used in COPD and asthma, and sometimes you might use it alone, or you might use it in combination with some other inhalers or medications depending on how bad your condition actually is. As with any prescription medication, there are a few things that you should be talking with your prescriber about, just so everyone's on the same page before starting, stopping, or changing the dose of your Symbicort. These include, but are not limited to, your current medications, vitamins or supplements if you are taking any special diets that you're on, if you have any other long-term conditions that could interact or interfere, or short-term conditions. A good example is if you are pregnant or planning to become pregnant. Now, before this next part, I just want to remind everybody that if you do plan on changing the way you take your Symbicort, it's always best to talk with your provider first so that they know and can help you make a decision together as to whether or not you can consider the updated recommendations. I bring this up because there are updated recommendations for taking Symbicort in patients with asthma. So again, talk with your provider if this is relevant for you. As for the older recommendations and how people typically take it, you'll see it taken twice a day, just inhaled twice a day with other medications alongside it, such as a rescue inhaler like albuterol. Now, if you miss a dose of Symbicort, typically you can just skip your missed dose and then just take the next one normally. Please don't double up on the dose to make up for a missed one. As for storage and handling, you should be keeping this at around room temperature. That's 73 degrees Fahrenheit, give or take, or 23 degrees Celsius. You should be storing this upright with the mouthpiece downward and then the mouthpiece cover on top of this. This is under pressure, by the way, so don't do anything that is prone to making it burst, such as puncturing it or leaving it in a really, really hot environment for way too long. Now, regardless of whether you have doses remaining, you should discard Symbicort after 3 months. Now, as to how you actually use it, let's go to a demonstration. Before using Symbicort, you should take it out of the foil pouch that it comes packaged in, and then write down the date that you did so. 3 months from that day is when you should discard Symbicort, as I mentioned just a moment ago. And so Symbicort comes like this. It has a red mouthpiece, and then this top part comes off, and this is the metal canister that it stores the drug in. And then on the top, there should be a little dose counter here that goes all the way from 0 to 120. So that's how many pumps this canister has. And so to put it back on, you can just take the red mouthpiece here and then just kind of slide it back in. This is the front, and it should fit snugly like that. Now, before using it, you should shake it for about 5 seconds. This is an aerosol can, by the way, so it's kind of like a shaving cream can. You want to give it a good shake before using it. And then to remove the mouth guard here, so you just squeeze on both sides, you pull forward, and it should come straight off. Not a lot of resistance there. There's a little hinge to keep it attached to the mouthpiece here. So, and then you should just check to see if there's anything on the inside there that could be obstructing it. Just make sure it's nice and clean before using it. Once you've given it a good shake, if you haven't used your inhaler before, or you haven't used it for more than 7 days, or if you just dropped your inhaler, then it's a good idea to prime it. So to prime it, all it means is just doing 2 test sprays, so to speak. So to spray it, go ahead and just hold it away from you here, and then just let it spray. And so that's the first spray for the priming. So give it another good shake for 5 seconds, and then do a second prime spray. So just like that. And then after that, your inhaler should be primed. Now, if this was brand new, the dose counter should still read 120. But if not, then the dose counter will read however many doses it has left. But by priming it after it's your first time, or you haven't again used it for at least 7 days, this ensures that each pump will deliver exactly the right amount of medication for you with every dose, even if it's near the end of its lifespan here. Okay, so this next part is a little hard to narrate and demonstrate at the same time, so you're just going to hear me in voiceover here. So you're going to see me hold up the inhaler. You can hold it with 1 or 2 hands, depending on whether or not you need a little bit more finger strength to make the pump work. Then you're going to exhale all the way out. We want to make sure all of the air in your lungs is out so that you can take a nice, deep, and slow breath. Then bring the mouthpiece up to your mouth, form a perfect seal around it with your lips, and then inhale slowly. You want to make sure that you're inhaling at least 10 seconds long, or as long as you are able to and are comfortable with. And as you start inhaling, go ahead and depress the pump on the inhaler, and make sure you hold that breath. Just keep breathing in so that all of that mist goes into the lungs where it's needed. At the end of the 10 seconds, you can go ahead and release the pump before you exhale all the way out. And then just if you need to take a second puff, then go ahead and shake up that can once more for 5 seconds and rinse, repeat. Now, speaking of rinsing, let's talk cleaning for a second. After you take your dose, you want to rinse your mouth with just regular old water and just swish it around in there and then spit it out afterwards. Don't swallow the water. This is to help prevent a side effect called thrush. Thrush is actually a term to describe a fungal infection in your mouth. It's not fun. And so after I did that demonstration, by the way, I just want to remind everybody that this is expired medications. I'm not actually taking any of this, and I plugged it up with a little bit of tape and some tissue paper beforehand here. So just as a precaution, though, I did still rinse my mouth out with water afterwards, just in case, right? You can never be too sure. So rinsing it with just water and then spitting out the rest afterwards has been proven to be very effective at keeping this side effect at bay. So again, rinse your mouth with water. Now, you might be tempted to clean this with water as well, but it really isn't necessary. All you got to do is just wipe it with a clean, dry cloth on the mouthpiece, on the inside and on the outside, and that's generally all you need to do. You don't need to take this apart. You don't need to submerge it or rinse it with water. This will do for the lifetime of this inhaler, which is, of course, 120 doses. Always check your dose counter after you're done with your dose so that once it gets into that yellow zone there, you can just make sure that your pharmacy has your refill ready, or if you need to make another appointment with your prescriber, you can go ahead and do so. I should mention, by the way, once the dose counter is closer to 0 and reaches 0, the pump might still actually work and you might still get sprays. It might not feel empty, but you might not get as much medicine as is guaranteed by these 120 sprays if you are using it properly. So again, make sure you prime it if you need to prime it. Make sure that you only use the 120 sprays that is indicated by the dosing meter so that you can get a refill when you need to, and you can make sure that you're getting all of the medicine that you need. All right, now that demonstration's over, let's talk side effects. These ones listed on screen aren't necessarily the end-all be-all list, but they are the most common and reasonably expected and worth talking about within this video. So you might get all of them, you might get none of them. It really depends, and so just bear that in mind. Now, I already talked about thrush, but another one is flu-like symptoms. One of the components in Symbicort here does take a little bit for your body to get used to, so until then, if your provider needs to give you a little bit of extra care, let them know, of course, but it should self-resolve by the time you get used to the medication. Some other ones include dry mouth, nausea, and cough, which is pretty reasonable to expect for an inhaler. So again, let these self-resolve, and they should be either gone or manageable by the time you get used to things. Now, the things that are good to know are basically just reminders of things that I've already gone over already, since they're pretty important. Rinsing your mouth after use is so important. I will never stop reminding people to do so, because it's just a really easy way to prevent a side effect. Just some tap water, swish, spit, don't swallow. It's that easy. Next up, always reprime your inhaler if it's been a while, more than 7 days, or if you dropped it. We just want to make sure that with every puff of the inhaler, you get exactly the medicine that you need and expect with every puff, all right? No more, no less, right? And you might think, oh, well, that's wasting 2 puffs here. That's wasting it. We'd rather you get the medicine that you expect and need reliably. And so 2 puffs is just a drop in the bucket. And again, this inhaler has 120 doses, 120 puffs in there. So it's very easy to see when you will need a refill anyway, so you don't really have to worry too much about going without medicine here, especially if you've got a pharmacy that you're very, very familiar with. So again, just it's very simple. I'll even do it again as I'm describing this last part. Just, shake it up for 5 seconds and then spray twice. Now, the last thing to note is to just clean your mouthpiece once a week, right? So just keeping things clean, again, also helps lessen the chance of thrush, but also it's just nice to use a clean inhaler. You're putting your mouth on this, you don't want it to be gross, so just a dry cloth every week just to wipe the inside and the outside will go a long way in keeping this clean. Thankfully, Symbicort isn't known to cause many situations, if at all, that require emergency medical assistance. So the only thing that we can reasonably watch out for is an allergic reaction. So if you have hives, rash, or ironically, if it's hard to breathe while using Symbicort, go ahead and seek out your nearest emergency department for some medical assistance. Now, some other serious things to look out for, if you are using Symbicort too often, right, if you find yourself needing to use it more often to stave off your symptoms for asthma or COPD, then you might want to have a chat with your prescriber about how it's going and how it's working out, because you might need more therapy, you might need some different options for therapy to help control your symptoms. Or you might need a little bit less. Maybe you kind of overshoot it and you don't necessarily need to have all of this medicine acting on your lungs at all times. And so this is for the sake of efficacy and safety. The other thing, too, is to make sure that however you're taking Symbicort, it is as prescribed and decided upon between you and your prescriber, right? Especially with those guideline updates, the way that you take Symbicort might be different from the way another person takes Symbicort. So make sure that you and your doctor are on the same page with how you're taking Symbicort. The last thing is that Symbicort can increase the risk of pneumonia, especially if you are especially vulnerable to this kind of thing, vulnerable to infections, or if your flu-like symptoms that I mentioned earlier don't go away on their own or even get worse. So if you feel the need to, talk to your provider about that and weigh the risks and benefits before proceeding with Symbicort. Alright, that was a lot of information, so let's go over the highlights on the summary card real quick. As always, this is a good time to screenshot this if you want this for quick reference, or if you're sharing it with a friend and they don't have time to watch the whole video. Symbicort is an inhaler for COPD and asthma. It relieves symptoms if you use it as a rescue inhaler, and can prevent symptoms when used as a maintenance inhaler. You should be inhaling this as directed. Your directions might be different from someone else who's using Symbicort, but regardless, wash your mouth after using it. When storing it, store it upright at room temperature, and just remember that the contents are under pressure. Don't expose it to any dangerous situations that might make it burst. If you do store it for a while, or if you drop it, you should reprime the inhaler by spraying 2 puffs into the air just to make sure that the inhaler can deliver the dose that you expect. Common side effects include thrush, dry mouth, nausea, cough, and flu-like symptoms, or cold-like symptoms. Serious side effects include pneumonia, and if you can experience an allergic reaction, you should seek medical attention right away. Alright, now with part 1 out of the way, let's move on to part 2 with some finer details on Symbicort's prescribing information, as well as some recent updates to its place in therapy and the guidelines. Now, I will do my best to make it as understandable as possible for even healthcare professionals, but if you don't have a science or a healthcare background, this might be a little bit hard to understand, and I recommend looking for your most accessible medical professional for advice if you need help understanding the landscape of medical information. Symbicort is a combination agent consisting of 2 active pharmaceutical ingredients. The first one is budesonide. This is classified as an inhaled corticosteroid, or ICS as it's commonly abbreviated. ICSs will mediate anti-inflammatory gene expression and, thanks to its route of administration, place a special emphasis on cells in the lungs. The second component is Formoterol. This is classified as a long-acting beta-2 agonist, or LABA as it's commonly abbreviated. Beta-2 agonists will activate beta-2 receptors, particularly in bronchial smooth muscles, thanks to, again, its route of administration. This will stimulate cyclic AMP-mediated smooth muscle relaxation, which will encourage airway dilation and make it easier for the patient to breathe. For official FDA uses currently, it is approved in the use of asthma and COPD as a maintenance inhaler. Off-label, Symbicort can be used for acute asthma exacerbations. More on that later. Now, this video is getting a little bit long at this point, so I'll just mention that I've already gone over most of the common adverse drug reaction highlights in the patient section, as well as ones for more serious ones, so I won't go over those again. And when I looked at the warnings list for the FDA package insert, there's quite a long list there, so I'll just be going over the highlights here, but you can always refer to the FDA package insert for the full list of warnings and precautions before prescribing this to your patient. Some of the highlights include, of course, not stacking with any other long-acting beta agonists in a patient's therapy plan. There's also a warning for the specific species of fungus that causes thrush, in this case Candida albicans. So the more technical term for thrush would be candidiasis in this case. Immunosuppression is also on there alongside bone mineral density reduction, as this medication has a corticosteroid agent, which are notorious for both of those potential side effects. For interactions, we find that 3A4 does indeed treat Symbicort as a substrate, so use caution with inhibitors of that enzyme. Another thing to use caution on is MAOIs and TCAs concurrently. This might make the LABA component stronger. Speaking of beta agents, we find that beta blockers will conflict in terms of its mechanism of action, so as you might expect, a beta agonist is going to do the opposite, and diuretics is another thing to watch out for concurrently, as this might exacerbate some hypokalemia or abnormal ECG readings. For contraindications, there isn't much listed. Of course, you can always say allergies, but severe cases of asthma or COPD might find Symbicort taking a sidelines towards more appropriate agents. Okay, let's talk dosing. Symbicort here comes in 2 different dosing strengths. These only alter the strength of the budesonide component. One is 80 micrograms and the other is 160, like I have in my hand here. Now, for patients with asthma that are 12 or older, then the dosing directions are 2 puffs of Symbicort, low or high dose, twice a day. For patients that are between 6 and 12 years old, Symbicort may only be used at the low dose, but with the same directions. For COPD, the opposite is true. Only the high dose is pertinent for COPD treatment. Now, as of 2021, the Global Initiative for Asthma, also known as GINA, has released new guidelines on asthma pharmacotherapy. in which they suggest that, based on the evidence that they have, a low dose of inhaled corticosteroids and long-acting beta agonist is effective for use as a rescue inhaler. And they've redone the 4 escalating steps for asthma treatment as a result. We'll go over that again later in my closing section, but for now, just know that the dosing for a rescue inhaler is the low-dose formulation as needed. I should note that from my experiences in ambulatory care practice based in Northern California, I should note that I often see this as needed dose stack on top of the maintenance dose. So a patient could effectively have the same inhaler for maintenance and rescue therapy. And some prescribers will choose to have maximum doses per day written into the prescription. Others may just say as needed. So it's really up to you and what you might know about your patient and as to what they can tolerate. For monitoring efficacy, regardless of whether or not Symbicort is being used as a rescue inhaler under the new guidelines or as a maintenance therapy inhaler under the old guidelines and the FDA label, it's important to consider how much a patient is using their rescue inhaler, again, whether it's Symbicort or albuterol or otherwise. The frequency of use can tell you how the patient is responding to therapy and whether or not you need to escalate or can hold the therapy steady at the current level that you have. The intensity and frequency in symptoms is the other thing to look out for, as the goal, of course, is to control those symptoms and to make sure that a patient can live a relatively unimpeded life despite their condition. Now, for safety, basically most of the safety parameters are revolving around the fact that a corticosteroid is in play. So, monitoring potassium levels, glucose levels, and cardiovascular parameters should come as no surprise. Another thing to look out for is, of course, infections from the immunosuppressive effects of corticosteroids. The last thing worth mentioning is that patients with glaucoma is recommended for close monitoring, as this might exacerbate the condition. So now we arrive to Symbicort's place in therapy. Let's look at asthma first. In the 2021 GINA guidelines, there's been an update to the preferred treatment for asthma patients. Instead of using albuterol as a rescue inhaler, it's been found that using a low dose of ICS combined with Formoterol is more effective at addressing acute exacerbations. So it is now the preferred rescue inhaler. Now, of all of the ICS and LABA combinations out on the market currently, only Symbicort has Formoterol as its long-acting beta agonist agent. So, naturally, Symbicort has a temporary monopoly on this and is the preferred therapy for patients going on this new treatment track. Of course, if push comes to shove, the patients can also opt to take the more traditional route of having albuterol as their rescue agent, but as I mentioned before, in clinical practice currently, I have already been seeing cases of doctors prescribing Symbicort as both a maintenance inhaler and a rescue inhaler. So this can ease the, well, I guess it's not a pill burden for a patient, but this can ease the inhaler burden of a patient if used correctly. Now, as for COPD, we have the 2020 GOLD guidelines as our latest update here, and not so hot for Symbicort since they're only recommended in category D, group D patients. These are patients that have both either 2 or more moderate exacerbations of their COPD symptoms, or 1 exacerbation that involves hospitalization within the past year or so, basically. And so this combined with a CAT score of 10 or more, or an MMRC evaluation of 2 or more, will land them in Group D and warrants the strongest therapies available, including combinations of ICS and LABA. So for Symbicort, here are my takeaways. Right now, I think it's a good, solid option now that this new treatment niche has been opened up by guidelines. The fact that Symbicort is not only a new option for rescue therapy, but also now the preferred option by the guidelines is pretty huge. That doesn't happen every day, and the fact that the evidence is now there for it is a pretty great sign. And I hope that we can make more discoveries like this in the future, because patients need to find what's right for them, and I'm glad that they now have more options. And hopefully, those who do take the option will benefit from the decreased pill burden, or I guess in this case, inhaler burden, that maintenance and rescue therapy on Symbicort can provide. Now, Symbicort isn't a perfect drug, and I think that the fact that we can counsel all day about avoiding thrush and it can still might happen is a problem. We definitely don't need more cases of infectious disease or candidiasis in our lives, especially in the current context that this video is being filmed in, which is early 2022, and SARS-CoV-2 is still spreading with whatever named variants that happen to be plaguing us at this time. So, you know, if a patient is prone to infections or definitely susceptible for worsening infections, it's something to consider with Symbicort and weighing your options there. So last but not least, I wanted to mention and touch upon the fact that AstraZeneca is probably having a field day right now, but I think it's important for providers to keep a lookout for other options that might pop up, whether that's the guidelines changing to accommodate more long-acting beta agonists besides Formoterol, or new products with Formoterol as its LABA to fill the niche, as it were, so that Symbicort doesn't take all the spotlight and all the fun for however many months, years that it takes. And for now, that's all I have to say about Symbicort. Thanks for watching. This video was filmed in February 2022 and reflects the current state of knowledge that we have about the drugs and diseases mentioned in this video. Full details can always be found in the FDA package insert that is available online and is where most of the information in this video is derived from. As for myself, my name has been Patrick, and whether you're a patient, provider, or both, take care of yourselves out there. Thanks for watching.